Hello and welcome to Health Matters on Channels Television. We hope you are staying safe. I am Mary Alale Yusuf. As at May 16th, 2020, the world had a confirmed COVID-19 caseload of about 4.5 million, over 1.6 million recoveries, and about 307,000 deaths. The United States of America still had the highest number of confirmed cases, with over 1.4 million, but sometime in the week, Russia took over from Spain as the country with the second highest number of cases, less than a fifth of the US caseload, and the UK came in third. In the same time frame, Nigeria's cases rose to 5,445, with 1,320 recoveries and 171 deaths in 34 states and the FCT. Lagos, with 2,278 cases, had more than twice the number of cases in any other state in the country, and about 42% of the country's COVID-19 burden. My guest is a public health physician, an executive member of the Nigerian Medical Association, Lagos chapter, and a member of the Association of Medical Officers of Health in Nigeria, Dr. Anne Okonma. You're welcome to the program.
Thank you. Thank you for having me, Mary.
Let me start off with a question that is on many people's minds. We've been with this virus for, almost 6 months now? Is this something you think will go away, like SARS or MERS? Or is this something that we're going to have to live with, like the seasonal flu?
Okay, thank you, Mary, for your question. If I did hear you well, you were asking if the COVID-19 is going to go away. Is that what you were asking?
I'm asking if this is going to go away, like SARS or MERS, or if it's going to stay like the seasonal flu. When you look at the virus, what's the behavior like?
Okay, so thank you, Mary. So basically, the COVID-19 is here to stay with us. And so we now will have to learn how to live with the virus. So it means that just like the flus and SARS, they have lived through it over the years through vaccination. And so at this point now, we will now have to think of how to have a lifestyle change, pending when the vaccines, we would have vaccines available for COVID-19.
The seasonal flu that people usually talk about, which they take a shot for every season, is it the 1918 flu pandemic, what they call the Spanish flu, that morphed into the seasonal flu?
Okay, so the seasonal flu that we're talking about is not the same thing as the 1918 pandemic. Yes, the Spanish flu is actually different. So the seasonal flu is one of the influencers for flu. Now, for the Spanish flu, it was actually a virus, but as at 1918, people didn't really know what they were dealing with at that point. So that was why that was more severe at that time, because a lot of people were not sure what it was, and so a lot of mistakes were made at that time. But one thing that worked for them at that time was the physical distancing and the wearing of the mask, which is what worked for them at that point.
That will be good still now. But some people argue that self-isolation was the bane of this pandemic. They say that the self-isolation gave people the opportunity to spread the virus to their family members because they did not understand what was being asked of them. What do you think?
Yes, so basically, Mary, what we have to do at this point is to engage our people from using a bottom-top approach. Now, like I said, at that time, they didn't even know what they were dealing with. So because of that, a lot of mistakes were made at that time. All they knew were that, okay, there were symptoms of respiratory infection like cough and sneezing. And so they knew that, okay, this thing could spread through droplets. And that time, they had said, okay, what had worked for them was social distancing, which at that time they had called crowd controlling. So they had limited the number of people who were in a particular place at a particular time. And then the wearing of the face masks. Now, if you relate that to now, even right now, a lot of people still do not understand what self-isolation really means and what it is to actually social distance or maintain a physical distancing. So we still have that problem even up till now. And so this is where an aggressive sensitization comes in, where we have to now mobilize people from the grassroots level. So it starts now with every individual being conscious of their environment, everybody beginning to behave as if they have the virus. So if all of us now behave like we have the virus, that way everyone will be more vigilant.
Okay, so that's a wonderful explanation, but you said lots of people still don't understand what physical distancing is. And so can you just go through it again, just for the sake of those who are watching?
Yes, so for the physical distancing, basically, what it means is keeping a distance of at least 2 meters from someone. Because what we need to understand is that this virus spreads through droplets. So it comes from secretions from droplets. So when I'm talking now, I'm releasing secretions of these droplets. But because of gravity, it drops. So it doesn't travel far if I'm not sneezing or I'm not coughing, if I'm not sneezing in particular. But while I'm talking, I'm releasing these droplets. So when you're standing and you have to have an interaction with someone, you can see the two hands, and then you're able to measure what 2 meters actually means. And so that way, distancing is about. Now, social distancing is basically avoiding any area that has large gatherings of people or a crowd.
Okay, Dr. Okonma, let me just ask you, we had high hopes that during the lockdown, most of those who had come in contact, who had contracted COVID-19 will be rounded up, and it will be almost a done deal by the time they ease the lockdown. But then we started to have community transmission. Is this the only thing that is going to beat this? Physical distancing, wearing of masks, and social distancing? Is that the only thing, or is there something more that we need to do?
Okay, thank you, Mary. Okay, so basically, what we have to do now, first of all, is taking responsibility. We need to understand what this virus is about. We need to understand the mode of transmission. Now, physical distancing and wearing of the mask will help a great deal to reduce the spread of this virus. But right now, we have an ongoing community transmission. So it means that at this point, if you do not have something tangible doing outside, then you should stay in your house. Apart from the physical distancing and the wearing of the mask, which will go a long way in curbing the spread and trying to put a stop to the spread of the virus, what we also need to do is to ensure that we disinfect our surfaces regularly and all that. But at this point, the government will need to engage all stakeholders. Like I said, everyone now has to see themselves as a potential carrier until we are able to attain a herd immunity. So it means that we have two options. At some point, everyone might have this disease. So about 90% of the people who might have this disease or the virus will get well even without treatment. That way, they can now form an immunity for this virus. And then we'll also have to now follow all health advisories strictly until when the vaccine comes up.
Okay, I think I begin to see the point. You're trying to raise a herd immunity so that it will be something that we can fight off anytime it comes. Is that it?
Yeah, because that is what, like I said, we'll have to live with that. So it means that at this point, people need to work on their immunity. So everyone has to see how they can boost their immunity. So as we, first of all, as human beings, taking responsibility, it means that we now have to make conscious effort on our own So yes, apart from the physical distancing, apart from the regular hand washing, the use of the alcohol-based hand sanitizer and disinfection of our surfaces, now on our own, we have to see how to build a strong immunity, especially if we do not have any underlying illnesses. Now, secondly, the government on its own would now have to see how they can now fund researches, how they would fund researches to go on so that we can also see how we can find a possible cure. We need to start to look inwards. So it means that starting from the home to the community, to the wards, to the local government, to the state and to national. We start from that approach. So that way we're engaging people. Now, the government at this point might start to look into renovating already existing structures. So it means that, yes, we cannot admit everybody. But when we have severe cases, yes, those severe cases, instead of everybody going to the isolation center, if you look at setting up an infection disease unit in all wards, then yes, those people can be managed at the ward level, not necessarily now being taken to the isolation centers, no. So at this point now, the government will have to do a lot. So we need to see a strong community will, political will coming on the part of government. There has to be some level of commitment on the side of government to fund and see how some of these things can be put in place, while we, the people, also take social responsibility and then play our own parts.
Dr. Okonma, we're asking, how long do you think it's going to take for us to have isolation centers at every ward with people staffed to take care of cases that come? Because a vaccine looks like it's going to take a while.
Yeah. Okay, so basically, Mary, we already have an existing structure at the ward levels. And so what the government needs to do is just to release funds, and then we can have like a 4 to 6 intensive care units in all the comprehensive health centers across the 57 LGS and LCDs. And so the government now would now need to release funds. They would now to provide adequate PPEs for the health workers, ambulance services. Already we have an emergency preparedness response command system at the LGA level. So they would need to also be carried along and then actively involved in this at this point. So everything still comes back to the government now. There has to be political will from the government. There has to be some level of good governance and accountability, and having in mind and taking us also back to universal health coverage, which means that there should be accessible healthcare to every individual at every level. There should be equity and there should be access.
It's impressive that the structure is already on ground. I'm just hoping that this is the same in every other state. Speaking of which, numbers are rising across the country. What do you think about a national lockdown?
Well, at this point,
answer that.
I do not think we...
Let's quickly take Benjamin's call, and then you go to that. Hello, Benjamin.
Hello, good day. Good afternoon.
Benjamin, what's your question?
My question is about... Hello?
We can hear you. We can hear you, Benjamin.
Okay. My question is about the vitamin C. About the boosting of the immune system. I want to know the kind of food that go through that can work apart from vitamin C.
Benjamin. So Dr. Okonma, he's asking about immune boosting foods and substances apart from vitamin C.
Okay. So basically, to boost your immune system, there are things that you need to do. First of all, you have to have a balanced diet. So you should eat every class of food, carbohydrates, protein, fruits, and vegetables. Now, it would be nice to have add plenty of vegetables and fruits also in your diet, like ugu, that's pumpkin leaf, water leaf, watermelon, pineapple, and the rest of them. Also, you could use natural teas. like lemon, moringa tea, turmeric, ginger, and garlic. So you could use those also. And then adequate sleep, at least 8 hours of sleep every day is very important. Then you also want to exercise regularly. So you want to exercise regularly, nothing rigorous. You could just take a long walk or take a run for 30 minutes, and then also exposure to the early morning sun so that you can have some vitamin D from there. So with all of this in place and then the lifestyle change, so if you're someone who smokes, you really want to stop all that. If you have other health, underlying health conditions, you also want to get further advice from your doctor. But basically, to boost your immune system, these are the things to look out. Ensure that you eat a balanced diet, eat plenty of fruits and vegetables, take natural drinks like ginger, garlic, turmeric, and the rest of them. Then also get adequate sleep, at least minimum of 8 hours sleep every day, exercise regularly, and then take a long walk. So get some vitamin D from the sun.
Thank you so much. So what is your idea about a national lockdown, maybe for a week or so?
Yes. So at this point, Mary, like I said, the virus is here to stay, basically for two reasons. It is highly infectious. And so it's an infected person can spread up to can infect one or two or three persons, sorry. And then also it is not as deadly as we all thought. So, but we must also apply caution for those who are elderly, those who have underlying illnesses. But basically, Mary, having a lockdown now is it's unnecessary because we've seen what has happened. So at this point, what the government really needs to focus its attention on is strong community advocacy at this point, starting from the grassroots level. So it means that from every home, from every community,
hello, Dr. Okonma,
to the world level. Yes, please.
Just a minute. I'm sorry to cut you there. Timothy is calling. Let's get this call from Timothy.
Good afternoon.
Good afternoon, Timothy. What's your question?
Yeah, I want to ask the doctor. If jogging and trekking, which one is more good?
I didn't get you, Timothy.
And secondly, I want the doctor to make the message to they said there is no house where they will isolate people in Lagos. There is a federal secretariat in Oniko. There is nobody there. There is a former NEPA office in Oniko there. There is nobody there. There is federal minister of work in Oniko. There is nobody there. Why can't they use all those government buildings instead of telling people there is no accommodation for isolation? Thank you.
Oh, okay. Thank you so much, Timothy. You heard that. He's talking about using government facilities as isolation centers. What do you think about that?
Okay. I think I had said something like that already. If at this point, like I said, we do not need to go into building of new facilities, but all we need to do is renovate already existing structures and facilities that we have at the primary healthcare level, at the secondary level, and at the tertiary level. So basically what they need to do now is just have about maybe 4 to 6 bed intensive units created. So every LGA, the government now should think of how to at least have an infectious disease unit in all the LGAs, the 57 comprehensive health care centers, the general hospitals, all the secondary institutions that we have. And then also they need to train staff, provide adequate PPEs for people to work, ambulance services, and a whole lot of emergency services. Everything has to be put in place.
Okay, let me just ask you to do a bit of analysis for us. For the past 6 or 7 weeks, the trend worldwide has been 500,000 to 600,000 new cases each week. I mean, each week, it seems to have been steady between 500,000 to 600,000 new cases. What does that mean for us worldwide? Is it bad? Is it a bad sign?
Yeah, so basically, Mary, at this point, you can see that there has been a lot of confusion and chaos globally. And one of the major problems that we're having is that, first of all, this COVID-19 is a novel virus. So we'll still have researches are still ongoing. So there is still a lot of confusion everywhere because every day new things keeps cropping up. But basically, we are not even testing enough. And you can see that even in the US, in the UK, there has been complaints of inadequate testing at this point. And the same also applies to Nigeria. We haven't even seen the worst yet because already we have some people who are even asymptomatic and in the communities already spreading this infection. So the spread, we're still going to see higher figures come out even as the day goes by. Even with the lockdown, we saw with the easing of the lockdown, we saw what happened, how everybody just came into the streets and it was as if they had just let everybody loose.
So basically, we're going to have to learn to live with this virus. I just want to quickly remind people that we have the NCDC website that can tell you about the goings on with COVID-19 in the country. And then there are emergency numbers that you can call if you don't feel well. The numbers, I believe they're coming on the screen now, emergency numbers. You can call if you don't feel well. And our figures have come from our global figures have come from the Johns Hopkins University website. Dr. Okonma, it's been such a pleasure talking to you and hearing your analysis. Thank you so much for coming on the show. And thank you, Timothy and Benjamin, for your calls. Do stay safe and have a wonderful day. I am Mary Alale Yusuf.